Good day. My name is Folusho Balogun from Cohort 5, and I'll be talking about the research titled Ensuring Infant Immunization Timeliness and Completion in Nigerian Urban Slums Through Older Women's Participation. Infant immunization in Nigeria is still suboptimal, and most of the infants who do not have up-to-date immunization are usually seen in families from the least wealth quintile, and these are typically seen in urban slum communities. There have been strategies in the past which were designed to address the problem of infant immunization in Nigeria, but these are not yielding satisfactory results. There is therefore a need for novel and multi-pronged approach to ensure that infants in Nigeria are optimally immunized. Older women in many African countries are saddled with the responsibility of overseeing the care of infants. They are highly respected and very influential. However, the formal healthcare sector is yet to recognize their influence. This study therefore sought to determine if training of older women about the infant immunization timeliness and completion can improve infant immunization uptake in urban slum communities. The objectives were to explore the views of these older women about infant immunization timeliness and completion, as well as other stakeholders involved in infant care, like community birth attendants and traditional healers, and also to use the outcome of this interview to design a training manual and a short video, which will be used in training older women about infant immunization timeliness and completion, and to determine the effects of these training materials on infant immunization uptake in urban slum communities in Ibadan. It was an exploratory sequential mix study that was carried out in 7 urban slum communities in Ibadan, Nigeria. And for the first objective, focus group discussion and in-depth interviews were used to collect data from older women, community birth attendants, and traditional healers. The outcome of this data were used to design a training manual and a short video for training older women about infant immunization timeliness and completion. And for the third objective, women in the 3rd trimester were approached in the clinic of community birth attendants and primary health care centers where they were having their antenatal care. And they were requested to bring the older women who will be responsible for the care of the unborn babies. Thereafter, these older women were trained, and their knowledge about infant immunization and also support that they gave for infant immunization were documented both at the baseline and after training. The infants, after they were born, were followed from birth to 9 months of age, when they were expected to have completed their infant immunization schedule according to the Nigerian immunization program. Results. All the stakeholders did not agree that older women had important roles to play in infant immunization, but they did not think that infant immunization timeliness nor completion were important. This training manual was a 7-module manual, and the video was was used as a complementary training material. There were 2 groups in the study, the intervention group and the control group. There were 105 pregnant women in the intervention group and 3 pregnant women in the control group. Then the 6 older women in the intervention group were trained, and their knowledge about infant immunization improved from 4.8 to 5.9, and support that they gave to infant immunization improved from 3.1 to 8.1. Both were statistically significant. At the end of the day, also in the intervention group, there were 109 infants, and there were 3 infants in the control group. Significantly, the infants in the intervention group, 67.9% of them significantly completed their immunization and had them at the right time, compared with 36.6% of infants in the control group. Looking at the infant immunization record in the 5 primary health care centers where immunization is being given, from 2014 to 2019, significantly, infants in 2019, which was the intervention year, had timely and complete immunization. In conclusion, training of older women who are caregivers for infants improves infant immunization significantly in urban slums. We'd like to thank Bill and Melinda Gates for funding this research, and also CARTA and CARTA funders because the skills for this research, from grants writing to manuscript writing, was from CARTA Fellowship.